Hello there, warriors. Imagine your brain as the main control tower of the Jurassic Park. There's a skilled team managing everything from remote signaling, communication networks, power management, to decision-making and problem-solving. Now, we can't talk about Jurassic Park without a sudden, unexpected, and disruptive event, like a major power outage in the control room. Suddenly facing a blackout, crucial information highways have gone dark, and the park faces a temporary shutdown of vital services. The sophisticated control room is in panic. Is there an exhibit breach and have any dangers escaped? Are there any casualties? There is no way to know and no way to control the situation without first getting the control room back in operation. The longer the blackout persists, the higher the risk of irreversible damage to the park. Even after the systems are back online, the control room is working against the clock to restore power and resume normal operations, and some parts of the park may never recover fully. The control room will have to call in support for rehabilitation and rebuilding damaged connections. This, in our body, is what happens when you get a stroke. During a stroke, a blood vessel supplying the brain gets blocked or bursts, disrupting the flow of oxygen and nutrients. In either case, if not treated in time, some parts of the brain experience permanent, irreversible damage. Does it sound scary? No need to worry, ladies and gentlemen. In our daily lives, our body sends us all the messages we need to make sure we take optimal care of it. All we have to do is pay attention to these subtle messages. Take a deep breath and familiarize yourself with these vital messages that could just be the key to saving your life. Stay tuned to find out the 9 warning signs that you can notice an entire month before in this ultimate guide to stroke. Don't forget to subscribe to our channel. We look out for your health with amazing wellness tips for a healthy life, and we would love for you to be a part of our community of warriors. Number 1. High blood pressure. High blood pressure, also known as hypertension, is the most important known risk factor for stroke. Blood pressure is a measure of the force with which your blood presses against the walls of your arteries as it circulates through the body, pumped by your heart. Due to circumstances where the blood vessels are narrowed by deposits of fat or cholesterol, as well as due to external pressure from enlarged organs, it causes the blood to flow in a narrower lane, causing higher amount of pressure exerted on the arterial walls. This also ends up putting more pressure on the heart to pump the blood. Imagine a water hose that you use to water your plants in the garden. If you press the pipe of the hose, you will see that the water starts flowing under more pressure. Now, if you apply pressure to multiple places throughout the length of the pipe, the built-up pressure will cause the pipe to detach from the tap due to the amount of pressure built up. In this way, the buildup of blood pressure over time can cause your heart to sustain damage, making it inefficient at pumping blood. Since a healthy supply of blood is required for our brain to carry out its functions, higher blood pressure significantly increases the risk of stroke. Factors like family history, old age, diabetes, obesity, drinking or smoking, as well as salty or high cholesterol diets, all contribute to high blood pressure. It's important to have a regular checkup with your healthcare provider to make sure your numbers are not off the charts. Small lifestyle changes like working out, a clean diet, and maintaining a healthy weight can help in preventing blood pressure issues. Number 2. Fatigue. A consistent feeling of tiredness without any apparent cause can be a hint that a stroke might be lurking around the corner. Fatigue without cause is a quiet signal to many brain-related issues which deserves a closer look. Fatigue is not just the feeling of being tired, it is your body's way to tell you that something is amiss. Lack of sleep could be an important factor putting stress on your body. This stress is a silent killer, slowly chipping away at your well-being. An unbalanced diet can also affect your body's energy, potentially increasing the risk of a stroke. Number 3. Vision problems. Vision is directly connected to the brain through nerve signals. Any vision issues are mostly connected with certain brain-related problems. They are like the brain's way of raising a noticeable red flag that tells us that blood flow to the brain might not be going as smoothly as we are expecting it to. When it comes to vision troubles, there is a range of common concerns that we should pay attention to. Blurriness, double vision, or partial or even complete loss of vision in one or both eyes are all key indicators to major issues, as well as a key indicator to a risk of stroke. With any change in vision, it is recommended to visit your doctor immediately. Number 4. Sudden headaches. If you experience sudden unexplained headaches, it could be your body's way to bring your attention to your health. Headaches come in all shapes and sizes, and it's important to note their origin. We often are not considerate of our meals and water intake, which can lead to sudden or random headaches due to fluid or nutrient depravity. Apart from this, there are migraines, tension, or sinusitis, which are common in the headache family. However, severe headaches with no underlying causes should not be ignored, as it is a sign of a potential stroke. Number 5. Numbness or weakness. Any sensation of numbness or weakness in the arms or legs should never be disregarded as a passing sensation. When you get a stroke, signals aren't getting relayed to parts of your body, which leads to numbness or even paralysis. This short bursts of numbness or weakness could potentially be a small case of obstructed blood flow, causing a minor delay in relaying signals to our body parts. This can also happen when you have pinched nerves, arthritis, or carpal tunnel syndrome, all of which are nervous issues that require medical attention. So the next time you feel these sensations, it's better to consult a doctor. Better safe than sorry. Number 6. Speech difficulties. Our brain is responsible for motor function, and speech, although it comes naturally from childhood, is actually a highly complex sensory motor skill. Stuttering, slurring your words, and having trouble finding the right words are all small indicators that there is something not right going on in your brain. It is like your brain and tongue are trying to sync but facing network issues. These speech problems could be a warning sign for a potential stroke, especially if noticed along with any other warning signs. Any unexplained speech problems warrant a visit to your physician for a checkup. Number 7. Memory problems. Similar to vision and speech, any issue in other brain functions as well is an indicator of brain-related problems. Memory is one of the brain's core responsibilities. The inability to remember everything clearly is just another sign of aging. However, sudden bouts of memory loss could be a potential indicator towards a stroke. A study by Erasmus University Rotterdam published in the journal Stroke mentions that there is a noteworthy association between memory loss and an increased risk of stroke, especially among individuals with a higher level of education. Number 8. Loss of balance. The motor function covered by our brain includes the complex order of movement and balance. Sudden loss of balance can potentially indicate damage to the brain's coordination center, which is responsible for harmonizing sensory inputs and motor outputs, ensuring precise movements and sense of balance. When this center is compromised, it can lead to improper signaling by the nerves, causing loss of equilibrium and balance. There can be several hidden factors like inner ear problems, muscle weakness, or medication side effects, which can disorient your spatial recognition. The effects of loss of balance can include dizziness, drowsiness, changes in blood pressure, as well as falls and injuries. Any loss of balance requires a prompt visit to a healthcare provider. Number 9. Nausea and vomiting. Nausea and vomiting serve as vital warning signs for a variety of issues in our system. They are usually regarded as indicators of pH imbalance or acidity and digestion-related issues involving stomach, intestines, liver, as well as kidney. However, nausea or vomiting are also important warning signs for brain-related issues, implicating improper blood flow to the brain. When brain function is compromised by improper blood supply, there can be lapses to response for our digestive system, causing reflux or vomiting and creating a sense of nausea. They are not exclusive warning signs of a stroke, but if noticed along with any other symptoms, are a cause for concern. Regardless, nausea and vomiting are a valid reason for getting a checkup from your physician. Oh, my dear warriors, the brain is the most important organ of our body, sending us priority messages when something in our body is amiss. Strokes can be especially deadly, and it's important to make sure to keep an eye out for these warning signs so that you can prevent the damage an entire month before it could happen. Cheers to wellness and health. This is Wellness Warriors, with another life-changing experience on how to take control of your healthy lifestyle. Please like, subscribe, and turn on the notifications so you don't miss out on the latest health tips and tricks to a better life.